time for this week's Health Watch, and the doctor is on call. Dr. Syed Hussain, Trinity Health of New England, joining us. Doctor, as always, great to have you with us. And off camera, you and I were talking about this. It is already buzzing. So I want to start with this. Accelerated aging linked to cancer risk in young people. We're talking about somebody's biologic age. Walk us through what we're looking at here.
Yeah, this is a really interesting study, Keith. So over the last several months, we've discussed how that we're seeing an uptick in cancer diagnoses, certain types of cancers in younger adults, more and more so. And so this study basically looked at what does biological aging do, and is there a correlation with certain cancers being diagnosed in younger adults? It's a large registry, a little under 150,000 people. Data was analyzed looking at 9 biomarkers and how that biological age, which is not, we know age is just not a number, right? It's basically, it's what wear and tear does the body undergo because of stress, genetics, lifestyle. That's your biological age, which is different from chronological age. And so what it basically, in a nutshell, the study found is accelerated aging in younger adults is tied to higher risk of certain cancers, whether it's stomach cancer, colon cancer, uterine cancer, lung cancer, things that we've seen an uptick with. So again, early days, very interesting research. More research needs to be done to what this really means. We don't know the why behind it yet, but suffice to say, if this generally holds and there's more data around this to validate these findings, then maybe perhaps we need to look at screening certain individuals who are higher risk earlier on so that we can catch those cancers.
I don't know, some of the power in our own hands, how we eat, exercise, sleep, you name it. Another topic that it gets a lot of attention, specifically on mornings. Folks are waking up with us. They start their day with a cup of coffee. After 7 or 8 o'clock, I switch to decaf. I know a lot of people do. It has to do with my schedule and when I can sleep. But there's a new conversation as to whether decaffeinated drinks are safe to drink.
Yeah, there are a number of health advocacy groups that have petitioned the FDA for a particular ingredient that's used in decaf coffee, and that's methylene chloride. It's a known carcinogen, which means it causes cancer. It's banned in every other industry. Very, very tiny amounts are allowed by the FDA to be used in decaf coffee. The FDA will weigh in later on this year, I believe it's in December, to say, okay, what's the data and what do we do with this decision? But in the meantime, if you are one of those people out there that drink decaf coffee, then what you can do is look at solvent-free on the label, on the container, or certified organic, for instance, to ensure that there's no methylene chloride being used.
All right, the next topic, getting a lot of buzz as well. We're talking about Botox, specifically fake Botox. We see folks getting into their 20s and 30s now. I was recently on vacation, people lining up in the Bahamas to get Botox at a pop-up shop. What is happening here? It sounds like it can be dangerous.
It can be dangerous. It can lead to people getting hospitalized. I believe there's a report out there from Illinois of 2 patients who've been hospitalized because of botulism. So it's really, really important that if you are considering this, that you go to a certified, health practitioner who deals with this, a clinic or a doctor's office, and not just any pop-up, because the effects can be quite dangerous.
All right, doctor, I know you're joining us on the holiday, so I appreciate that. Happy Eid to you and your family.
Thanks so much.
Erica, 3 topics, getting a lot of buzz. We'll get this segment up on our website, fox61.com, a little later on today.
Absolutely, really important stuff. Thanks so much, Keith.